day in the morning when I walk into the office, Shanti Didi welcomes us with a big, bright smile. Little do we know, Shanti Didi is a single mother and has a teenage son, deals with financial anxiety, loneliness, burnout, and so much more. But we could never tell. So when she smiles, at what cost is Shanti Didi really smiling? Namaste, my name is Shreeya Giri, and standing in front of you here today, I am representing one among 66% of the Nepal's population, which is of the working age. Being a mental health advocate, I started wondering who really is looking after the entire population who is so dedicated and invested into the working style. So then I found out that there is a mental health blind spot for the workforces of Nepali people all around the country. So if you're asking, what is mental health blind spot? It is when stress and burnout goes unnoticed and leaves employees unsupported where well-being is overlooked. Stress, anxiety, burnout, one of the most common terms that we usually hear. But you will be appalled to know that more than 70% employees all around the world experience stress and anxiety. And standing in front of you here today in Nepal, I would love to give you the similar data of Nepal as well. However, feelings and emotions and experiences like stress and anxiety is unrecognized amongst Nepali. Hence, the data is also go unreported. Reason? Lack of awareness, which is also the same reason why only 1 out of 10 people actually come forward to get and receive the mental health care that we need. Again, reason, lack of awareness, and social stigma. Awareness, how you ask? We don't know how does stress look like? How does stress feel like? How does it impact our thought process, our mind, our body, our behaviors, and so on? But okay, if it was only about stress and anxiety, then maybe not so many thousands of people would be so enthusiastic to talk about why workplace mental health needs an attention. But here, we are talking about death. Suicide is the leading cause of death for Nepali men aged 15 to 49, reason mostly tied with workplace pressure. Living in 2024 this year, I'm sure we all have come across many news in Nepal and even in our neighboring countries like India, where we have visibly seen and recorded so many suicide reports merely because of stress and workplace pressure. So, if it was only about individual lives, then maybe not many people would have really mattered and looked into it. But you will be appalled to yet again know that the cost of ignoring mental health issues in workplace is costing us $1 trillion globally every year. How, you ask? Absence of mental health care, support, and space in workplace also results in absenteeism. Stress also manifests in your body, where you invest more into your healthcare and insurances. Less employees stay back into office because they rather prefer to look after themselves, and less confidence in the employees, hence maybe encouraging them to settle for a less stressful job. Therefore, I thought if there's so much chaos happening all around the world, if people are losing life, if the economy is losing so much money, then what about the government? What about the policies? Which brings me to Nepal's national mental health policy drafted in 1997. It's almost as old as I am. But sure, there has been other mental health policies like Mental Health Policy Action Plan in 2020 as well, which you would think that maybe there are progresses happening. Maybe the government do care about mental health in workplace, but You will be surprised to hear a 27-year-old policy still struggles to be implemented in our nation. Why, you ask? Again, lack of awareness, lack of budget, lack of interest, lack of priorities. But okay, let's leave mental health and workforce. Let's look into Labor Act 2017, which advocates for the rights and the well-being focus for the laborers. What does it really say? It only focuses about physical well-being and barely even touches upon the psychological safety and the well-being of the laborers. So who here is really looking after the mental health of the laborers, which covers the 66% of the entire population? Which brings me to asking you a question: at what human cost are we as an individual, community, government, organizations are really ignoring mental health in workplace? Because let me tell you, when a stressed employee goes back home, they fail to be present for themselves, for their family, for their partner, and their child. Not only just impacting the relationships within the family, but also for the child and hence impacting the psychological development forever. A stressed employee also struggles to go back into community, slowly prefers to rather maybe isolate themselves, hence decreasing the community participation, showing less for the communities, showing less for the society. And like as mentioned earlier, when you ignore the mental health, you fail to be able to manage yourself. You fail to be able to manage your stress. And slowly, eventually, you fail to be able to manage your finances. So, overall, if you're looking at it, you are ignoring your family, your friends, your education, your economy, the community, all of it. So, if I am here utilizing this platform today representing Nepal, I also extend a request to everyone. If we are not to use yet again $1 trillion every year, if we are not to lose out another human to workplace stress, then what needs to be changed? Dear policymakers, please take references from amazing countries like US, UK, Canada, New Zealand, Singapore, who have resources and offer fundings to encourage workplace to adopt well-being strategies. Dear employers, please take references from organizations like Unilever and DHL who conduct mental health campaigns and assessments to look after the employees' psychological needs and care. And dear youths of Nepal, as an employee, please demand and use the well-being services as a right to health and safety. Because in forms of Shanti, we have doctors who experience domestic violences at home, yet show up at their offices with no psychological support. We have Shanti Didis who also show up as a pilot, who also experience trauma after flights crashing down, and yet show up with a big bright smile serving back to you. Hence, we all play a part to ensure that no one in Nepal's workforce has to struggle in silence, and hereby I welcome you all to join the force to make sure that 66% of Nepal's population deserves and demands the mental health rights that we all deserve. Thank you.